The Cass review was carried out by a policy working group that was formed in January 2020 by the NHS England. It sought to assess the evidence on the use of puberty blockers and masculinizing and feminizing hormones in gender dysphoric children and young people. The goal of this group was to inform future policy on these treatments, and Dr. Hilary Cass, one of England's top pediatricians, was appointed to chair the group due to increasing polarization among clinical professionals. The need for an independent review became evident as a result of significant changes over the past 10 to 15 years. There was a dramatic increase in the number of children and young people seeking help from the NHS, exceeding the capacity of available services and resulting in waiting times of over 2 years. There was also a notable shift in the demographic of patients, from mostly pre-pubertal males to predominantly peri- or post-pubertal females, with no clear explanation for this change. There were many people who were a part of the development of the Cass review. The policy working group itself was composed of 2 senior members from the Gender Identity Development Service at the Tavistock, 3 endocrinologists from Associated Gender Services, and 3 representatives with lived experience. It also included representatives from the Royal College of Pediatrics and Child Health and the Royal College of Psychiatrists, an academic child psychiatrist, a primary care academic, and an academic ethicist. NHS England staff were also involved, including a public health consultant, the national head of safeguarding, the senior pharmacy lead, and pertinent members of the specialized commissioning team. The final report was published in April 2024. It focused on how the current clinical approach and service model should be improved and sought to understand existing challenges. Intended primarily for service commissioners and providers of children and young people struggling with gender distress, the report also sought to be accessible to a wider audience. While the review is cognizant of the broader cultural and societal debates related to the rights of transgender people, it didn't take any position on the beliefs that underpin these debates, and took a strictly clinical focus in assessing the services provided to children and young people who seek help from the NHS. The review followed NHS England's standardized protocol for developing clinical services, and the National Institute for Health and Care Excellence was commissioned to evaluate the evidence according to stringent criteria. It focused on hearing from a diverse array of perspectives to better understand the challenges within the current system and aspirations for how these challenges could be addressed. Findings were supported by systematic reviews with full peer-reviewed papers available through open access in the British Medical Journal. The review reflects the evidence available at the time and provides recommendations based on this information. It identified several limitations in the examined studies on puberty blockers and gender-affirming hormones for children and adolescents struggling with gender dysphoria. The studies were found to be small, uncontrolled, and lacking in reliable comparative data and clear outcomes, resulting in low certainty of results. For puberty blockers, the evidence on impacts like gender dysphoria, mental health, and body image were minimal and unreliable, with no clear safety outcomes. Similarly, the review of gender-affirming hormones revealed that studies were uncontrolled and had short follow-up periods, and the lack of detailed reporting on comorbidities and concurrent treatments made it difficult to determine whether any observed improvements in symptoms were due to the hormones or other factors.